Imagine finally getting a prescription to save your skin from this incredibly painful, incurable condition. Like, you were just desperate for relief.
Oh, absolutely. You'd be counting down the minutes to get to the pharmacy.
Right. But then you get home, you unfold that massive paper leaflet inside the box, and it literally screams at you in bold, capitalized letters to never apply this medication to the exact spot your doctor just told you to put it.
Yeah, that is a completely terrifying moment for anyone. I mean, who are you supposed to trust in that situation?
Exactly.
Yeah.
And yet, that is a dilemma faced by thousands of people every single day navigating a very specific chronic dermatological condition.
It really is. It's a huge hurdle right out of the gate.
So, welcome to your personalized deep dive. Today, our mission is to explore this whole stack of medical guidelines we've gathered. We're looking at protocols from the British Association of Dermatologists, the National Institute for Health and Care Excellence, clinical trial data, and NHS patient leaflets.
You've got a lot of ground to cover with these sources.
We really do. We are unpacking a chronic, heavily stigmatized, and honestly often misdiagnosed condition called lichen sclerosus, or LS. And we're really going to focus heavily on how natural remedies fit into this puzzle, alongside the standard medical treatments.
What's fascinating here is that while lichen sclerosus presents as a severe skin issue, the root cause isn't actually in the skin itself.
Wait, really? Because it looks like a skin disease.
Right. It looks like one, but it is an autoimmune response. And that fundamentally alters how we have to approach treatment, because we aren't fighting, an external infection. We are fighting the body's internal messaging.
Okay, let's unpack this, because before we can get into that bizarre medication paradox or the incredible natural remedies people are using to survive it, we need to understand the battlefield.
For sure. The mechanics of it are crucial.
If it's not an infection, what exactly is happening to the body here?
Well, lichen sclerosus is a chronic inflammatory condition that primarily attacks the anogenital areas. So in women, that means the vulva, and in men, the penis and foreskin. In fact, in men, you might actually hear a doctor refer to it by its older medical name, which is balanitis serotica obliterans.
Balanitis serotica obliterans. Wow, that sounds incredibly intense. I mean, what does that actually translate to?
I know, it's a mouthful.
Oh.
But the Latin roots actually give you a very grim, clear picture of what the disease does. So balanitis refers to inflammation of the glands. Serotica means dry.
Okay, dry inflammation, I follow that. But what about the last part?
Yeah, obliterans literally means obliterating or destroying the normal architecture of the tissue through severe scarring.
Obliterating. Wow, so the inflammation is so intense it's actively wiping out the normal structure of the skin?
Exactly. The symptoms completely reflect that destruction. The affected skin develops this white, shiny appearance. Clinically, it's often described as looking like wrinkled tissue paper.
Tissue paper? Oh, that sounds so fragile.
It is incredibly fragile.
Yeah.
The structural integrity is just gone. So it bruises easily, it tears, it blisters.
Ugh, that sounds awful.
And the hallmark symptom is this unyielding, agonizing itching, which, for some neurobiological reason we don't fully understand, tends to peak in the middle of the night.
Oh, no. So it's completely destroying a person's sleep architecture, too.
Completely. And if the skin is literally tearing like wet tissue paper, the psychological toll must be immense, especially considering, where this is happening on the body.
Yeah, it's such a sensitive, intimate area.
Right. And beyond the pain, if this chronic inflammation is left unchecked, that obliterance part really kicks in. The skin undergoes hyperkeratosis. It thickens and scars.
So it goes from tissue paper to thick scar tissue.
Yes, and in the genital area, this scar-like process physically tightens and shrinks the skin. In women, the vulva can actually fuse, physically narrowing the entrance to the vagina.
Oh my God.
And in men, it restricts the foreskin, leading to painful physical blockages. I mean, we are talking about severe pain during sex, difficulty urinating, and just a massive impairment to overall quality of life.
I noticed in the stack of research that because this is an autoimmune glitch, it rarely shows up alone.
That's right.
If your immune system is confused enough to attack your skin, does that mean other internal systems are misfiring too?
The clinical data strongly supports that connection, yeah. A significant percentage of people with LS also test positive for other autoimmune markers.
Like what kind of markers?
We see a very high correlation with autoimmune thyroid disorders, specifically Hashimoto's disease, as well as vitiligo and even type 1 diabetes. It is essentially a systemic susceptibility to friendly fire.
That is so interesting, and it brings up a mechanism mentioned in the guidelines that just blew my mind, the Kubner response.
Ah, yes, the Kubner response.
If I'm understanding this correctly, it means the disease actually targets areas of trauma.
It is a critical piece of the puzzle, yes.
hmm
Essentially, physical trauma, friction, or even microscopic damage to the skin acts like a homing beacon.
A homing beacon for the immune system.
Exactly. It can trigger the disease to appear in that specific spot for the very first time. Or, if you have an existing quiet case, it can cause a sudden severe flare-up to just explode.
Let me see if I can picture this mechanism because it's wild. It's almost like the skin is equipped with a high security alarm system that has completely lost its calibration.
That's a great way to put it.
Right, like normally if you get a tiny microscopic scratch from wearing tight jeans, the body sends a couple of security guards, your standard healing factors, to quietly patch up the scratch.
Just a routine maintenance crew.
Exactly. But with LS, the alarm system panics. It doesn't send two guards. It calls in a heavily armed SWAT team.
I love that analogy.
Yay.
And that SWAT team doesn't care about collateral damage at all. They flood the area with inflammatory cytokines, causing absolute chaos to deal with a minor perceived threat.
Oh, so they're basically blowing up the building to stop a shoplifter.
Spot on. Instead of fixing the scratch, they destroy the local neighborhood, leaving permanent scar tissue in their wake.
Wow. Okay, so if your own immune system is deploying a SWAT team over a little bit of clothing friction, how do you call off the troops?
That is the big question.
And that brings us back to that terrifying warning label I mentioned earlier. What is the actual medical intervention here?
Well, knowing the severity of the inflammation, the undisputed medical gold standard across both the British Association of Dermatologists and NHS guidelines is the use of ultra-potent topical corticosteroids.
Ultra potent. That sounds serious.
It is. We are talking about highly concentrated medications like clobetasol propionate or mometasone. These are absolutely not your everyday over-the-counter anti-itch cream.
Right, this isn't hydrocortisone.
Not at all. They're designed to aggressively source that local immune response into submission.
But wait, if my skin is already thinning out like tissue paper and tearing, why on earth would I put an ultra-potent steroid on it?
I know, it sounds completely counterintuitive.
Right, because everyone always says steroids thin the skin. Won't that just dissolve whatever fragile skin I have left?
If we connect this to the bigger picture, we really have to look at the difference between healthy skin and LS-affected skin.
Okay, break that down for me.
You are absolutely right that if a person applied clobetasol to a normal, healthy patch of skin every day, it would eventually cause atrophy or thinning.
Which is exactly why that alarming manufacturer's leaflet exists in the box.
Yes, it is a blanket warning for the general public to prevent misuse for, everyday rashes or eczema.
So the warning label is basically treating me like I'm trying to cure a mosquito bite with a bazooka.
That's exactly it. But here is the crucial distinction for someone with lichen sclerosus. The tissue paper thinning you were experiencing is caused by the disease itself.
Okay, so the disease is the thing eating the skin.
Yes. The inflammation is actively destroying the skin's healthy collagen architecture. When you apply the ultrapotent steroid to that specific area, it acts like a freeze ray on the SWAT team. It halts the destructive inflammation.
So by stopping the destruction, the skin finally has a chance to breathe.
More than just breathe. Once the inflammation is suppressed, the steroid actually allows the skin to reverse the thinning.
Wait, reverse it? I didn't know steroids could do that.
In this specific context, yes. It gives the basal cells a chance to rebuild healthy, normal thickness, preventing that irreversible scarring. So the steroid isn't thinning the skin here. It is the only thing saving it.
Okay, that makes so much sense when you explain the underlying mechanism. The medicine is stopping the disease from dissolving the tissue.
Precisely.
But looking at the clinical guidelines, they are incredibly strict about how you use this bazooka. It's not like body lotion.
Oh no, the precision is key. The standard induction regimen usually requires applying the ointment once daily for a month, then alternate days for a month, and then twice weekly as a maintenance dose.
And you use barely any of it, right?
A minuscule amount,
Mm.
a fingertip unit, or roughly a pea-sized amount. A single 30-gram tube is expected to last a patient a full 3 months.
Okay, so the steroid puts out the fire. But if the steroid is just pulling the SWAT team out, the battlefield is still a wrecked, smoldering mess.
That's a very accurate way to look at it.
And the reality is many people are desperately searching for natural ways to heal that damage and manage their daily symptoms, which is really the major focus of our deep dive today. Where do natural remedies actually fit into this equation?
It's a huge topic for patients.
Are people actually using coconut oil to cure an autoimmune disease?
This is an area where we really have to tread carefully and look at the robust clinical evidence. Medically speaking, there is no evidence that purely natural remedies can alter the underlying autoimmune response.
So they won't put lichen sclerosus into remission.
No. And delaying or avoiding steroid treatment in moderate to severe cases usually leads to that permanent architectural destruction we talked about.
So natural remedies aren't a replacement for the heavy artillery.
No, they are viewed medically as essential adjuncts, meaning supportive, complementary measures.
But adjunct makes it sound optional.
I know, but do not let the word adjunct fool you. They are absolutely vital because even with a steroid suppressing the immune system, the patient is still walking around with a severely compromised physical skin barrier.
Let me try a different analogy then. If the steroid is fixing the underlying engine of the car, is using something like coconut oil basically taping a tarp over a broken windshield?
Oh, I like that.
Like it doesn't fix the car, but it stops the rain from ruining the dashboard while you drive?
That perfectly captures the biological mechanism. We call this barrier protection. And the primary natural defense is the aggressive use of emollients.
What exactly counts as an emollient in this case?
This could be plain petroleum jelly, medical-grade moisturizers, or very often natural options like coconut oil.
And they just sit on top of the skin.
Right. Emollients don't have the pharmacological ability to repair your DNA or suppress T cells. What they do is trap the skin's natural moisture inside, keeping the fragile tissue pliable.
And more importantly, they keep the outside world out. Because based on the guidelines, the outside world is incredibly hostile to LS skin, specifically urine.
Yes. The guidelines explicitly identify urine as a major irritant.
Which is awful considering where this disease is located.
Exactly. Urine contains uric acid, salts, and sometimes ammonia. When those highly reactive compounds hit a microscopic fissure in unprotected LS skin, it causes excruciating stinging.
Just adding insult to injury.
And it gets worse.
Yeah.
That chemical burn triggers the Koebner response, signaling the immune system that the area is under attack again.
Wow. So by applying a thick layer of coconut oil before using the toilet, you are literally waterproofing the broken windshield.
Yes, exactly.
The acid bounces off the oil instead of seeping into the cracks.
You are maintaining a continuous physical moat. The sources emphasize reapplying these natural barriers 3 to 5 times a day.
That is a lot of maintenance.
It is. And this brings us to another critical lifestyle intervention, how you wash.
Oh, right, because of the moat.
Exactly. If the whole point of that coconut oil moat is to protect the skin's hydration, a standard bar of body wash is basically throwing a bomb into the moat.
Because soap is literally designed to dissolve oil in grease.
The guidelines are unanimous and unforgiving on this point. Absolutely no scented soaps, no bubble baths, no shower gels, and no wet wipes.
Not even the gentle ones.
Not even those. Products heavily marketed as gentle or pH-balanced feminine hygiene washes contain surfactants.
Surfactants, those are the sudsy chemicals, right?
Yes. They're designed to break surface tension and strip away lipids. If you use them on LS skin, you are stripping away the protective barrier and exposing raw nerve endings directly to the air.
Ouch. So what are you supposed to use? The NHS leaflets suggest washing with just plain warm water or using your emollient as a soap substitute.
Plain water is often best.
But what about when someone is in the middle of a massive flare-up? When the itching is so bad they can't sleep? I saw baking soda mentioned repeatedly in the patient guides.
Yes, baking soda is a very common natural remedy for flare-ups.
But how does a baking ingredient help a severe autoimmune skin disorder?
It comes down to basic chemistry. Baking soda, or sodium bicarbonate, is naturally alkaline.
All right.
During a flare-up, the skin is highly inflamed, micro tears are present, and any residual acidity from sweat or urine just exacerbates the burning sensation.
Right, acid on an open wound.
Exactly. So dissolving a small amount of baking soda in a warm bath creates a mildly alkaline solution. When a patient sits in this soak, it temporarily alters the local pH environment.
So it neutralizes the acid.
Yes. It neutralizes the acidic irritants and provides immediate soothing relief to those exposed nerve endings. It doesn't cure the disease, obviously, but it breaks the agonizing pain cycle.
That makes total sense. It's chemistry over pharmacology.
Yeah.
And speaking of the environment, we also need to talk about the physical environment you are putting your body in all day, your wardrobe.
Oh, this is a massive factor.
If the Koebner response means friction equals an immune system attack, Your clothes could literally be your own worst enemy.
This is where natural management requires a profound adjustment to daily life. You are essentially forced to curate a zero-friction, highly breathable microclimate for the skin.
So what does that look like?
The universal recommendation is 100% cotton or silk underwear.
So synthetic fibers are totally out?
Completely. Synthetic materials like polyester, nylon, and elastane,
Mm.
they trap heat and they trap moisture. They do not breathe.
And I'm guessing a warm, damp environment is bad news.
Very bad news. For someone with LS, a warm, damp, enclosed environment is a breeding ground for secondary yeast or bacterial infections, which this compromised skin is already highly susceptible to.
The guidelines go as far as saying to completely ditch tights, yoga leggings, and skinny jeans.
Yep, anything tight is a risk.
Now, what about exercise? If I'm an avid cyclist or I love horseback riding, do I have to give that up?
Unfortunately, medical professionals often advise pausing those specific, high-friction activities until the disease is fully under control.
That has to be devastating for athletes.
It is. But the repetitive saddle friction from cycling is a direct, mechanical trigger for the Kubner response. You simply cannot out-medicate continuous physical trauma.
You really are rebuilding your entire environment. So we have the steroids putting out the autoimmune fire from the inside, and the natural remedies, the coconut oil barriers, the baking soda soaks, the loose cotton protecting the skin from the outside.
That's the ideal management plan.
But what happens when that combination fails? Because the sources show that some people simply don't respond to steroids, or their skin anatomy continues to shrink despite everything they try.
That is the unfortunate reality for a subset of patients.
This leads us to the frontier of LS treatment.
This is a highly active area of medical research right now because doctors recognize the urgent need for alternatives to lifelong immune suppression.
What are they looking at?
One of the major avenues being explored is energy-based treatments, specifically fractional CO2 lasers, such as the new V system.
I have to admit, when I first read that, it sounded completely paradoxical to me.
How so?
Well, if friction and trauma trigger an autoimmune attack, how does shooting a literal laser beam at the skin help?
It does sound crazy, but it relies on the concept of microscopic controlled thermal injury. The fractional laser doesn't burn the entire surface of the skin.
Okay.
It punches microscopic columns of heat deep into the dermis, but it leaves healthy tissue around each column.
What does that do?
The theory is that this specific controlled thermal damage forces the skin's fibroblasts to wake up. It prompts them to start rapidly producing fresh collagen and elastin, essentially remodeling the scar tissue from the inside out.
Wow. And do the clinical trials actually back that up?
The results are complex. Patients often report significant improvements on the vaginal health index, citing relief from dryness, improved elasticity, and a real reduction in pain.
That sounds incredibly promising.
It does. However, bodies like NICE and the British Society for the Study of Vulval Disease issue a very strong note of caution.
What's the catch?
While the laser may structurally remodel the collagen and relieve the physical symptoms of tissue atrophy, there isn't enough robust long-term evidence proving that it actually halts the underlying autoimmune inflammation.
Oh, I see.
The fear is that a patient might feel mechanically better, while the lymphocytic cells are still silently simmering underneath, meaning the disease process hasn't actually been switched off.
That is a terrifying thought, feeling cured while the foundation is still rotting.
Exactly. It's a risk they are still studying.
But here's where it gets really interesting. If lasers are a question mark, the sources dive into a completely different branch of science, regenerative medicine, specifically the Leukemia trial.
Ah, yes, the Leukemia trial.
This involves using the patient's own blood and fat, right?
Yes, led by Dr. Patricia Gutierrez Ontalvilla. It represents a massive paradigm shift. It utilizes a procedure known as lipofilling, or fat grafting, combining the patient's own fat-derived stem cells with platelet-rich plasma, or PRP, and injecting it directly into the affected vulvar tissue.
Okay, let me get this straight. So they extract fat from somewhere else on your body, harvest the stem cells, mix it with healing factor spun out of your own blood, and inject it straight into the LS scars.
That's the process, yes.
That bridges this incredible gap between a completely natural bodily substance and high-tech medicine. But how does a fat cell fight an autoimmune disease?
This raises an important question about the fundamental nature of cellular healing. The stem cells derived from adipose, or fat tissue, are called mesenchymal stem cells.
Okay.
They possess highly documented anti-inflammatory and immunoregulatory properties. Unlike a steroid, which acts like a blanket silencing the entire immune system in that area, These stem cells operate like cellular diplomats.
Diplomats, how so?
They release chemical messengers called cytokines. When injected into the LS tissue, these cytokines intercept the aggressive orders being given by the local immune cells.
They intercept the SWAT team's radio.
Exactly. They actively signal the SWAT team to stand down, and more importantly, they rewrite the orders. They instruct the local environment to begin regenerating blood vessels and healthy tissue.
That is incredible.
They don't just suppress, they re-educate the immune environment.
That is mind-blowing. And the clinical data from the trial seems incredibly promising, right? Especially for patients who had completely failed the standard steroid therapies.
Very promising.
The sources noted significant measurable improvements in pain, itching, painful sex, and actual visible regeneration of the tissue architecture.
It is a profound shift from a strategy of lifelong suppression to a strategy of active biological regeneration. We are attempting to equip the damaged tissue with the precise biological tools it needs to repair itself.
Okay, let's pull all of this together because we have covered a massive amount of ground today. Lichen sclerosus is not just a rash.
Definitely not.
It is a highly complex, chronic autoimmune condition where the body mistakenly deploys an immune system SWAT team to attack its own skin, leading to severe pain and potential architectural destruction.
And we have established that while ultra-potent steroids remain the absolute gold standard for freezing that destructive inflammation in its tracks, medical treatment does not exist in a vacuum.
Exactly. The natural remedies and lifestyle tweaks we explored are not just nice-to-haves or wellness fads.
They are essential.
Building that protective moisture moat with coconut oil, neutralizing acid burns with baking soda soaks, wearing breathable cotton, and rigorously avoiding friction, these are vital daily survival strategies.
Absolutely. They're the only way to prevent the Kobner response from sounding the alarm in the first place.
It requires a relentless dual approach. And as we conclude, it is absolutely critical to highlight one final reality of this condition.
Yes, this is a crucial point for anyone listening.
Regardless of whether a patient is managing this with steroids, emollients, or exploring regenerative trials, regular medical monitoring is non-negotiable.
It really is.
Yeah.
Patients with LS have a small, roughly 2 to 5% lifetime risk of the affected skin mutating into squamous cell carcinoma, which is a type of skin cancer.
Because chronic, unchecked inflammation fundamentally damages cellular DNA over time.
Exactly.
Which means checking your own skin monthly for unusual lumps, ulcers, or changes, and keeping that baseline inflammation down is quite literally life-saving.
That is the ultimate goal. Long-term, sustained control of the tissue environment.
So what does this all mean for you? We learned today that LS is your immune system acting like a malfunctioning alarm, destroying your own skin over something as minor as a scratch.
Right.
But we also learned that new regenerative therapies are utilizing your body's own fat-derived stem cells, those cellular diplomats, to try and rewrite the skin's destiny.
It's an exciting frontier.
It makes you wonder if regenerative treatments like fat grafting can introduce chemical messengers that re-educate the tissue and its immune response. Could the future of treating autoimmune conditions lie not in constantly dropping steroid bombs on the immune system, but in completely erasing and resetting the skin's cellular memory?
It's a fascinating possibility.
Think about that the next time you look at a simple skin rash and realize just how profoundly complex the fortress of your body really is.